70% of the global health workforce, women are the backbone of our health systems, but their contributions too often go undervalued and under-recognized. In Africa, women account for over 60% of formal healthcare, but remain concentrated at the lower levels, a trend powered by several social, cultural, and systemic barriers that the organization WomenLift Health is aiming to break. Welcome to Focus on WomenLift Health Global Conference with Amie Batson, the President of WomenLift Health. Welcome, Amie.
Thank you so much for having me.
Let's begin with the overarching goal of the WomenLift Health Global Conference, and why is this conversation on women's leadership more timely today?
Well, it really comes down to leadership matters. Who leads and how they lead has tremendous implications for the big health challenges that we're seeing in every country and around the world. And so this conference is focused on reimagining leadership and looking at how do we get that diversity of leadership, the representation of different populations, different genders at the decision-making tables to make sure that we're making the best decisions, that we're taking into account all of the data, all of the needs, so that we can be improving health.
Could you briefly give us an insight into what not having women in leadership positions in healthcare leads to? What kind of challenges, which makes you so passionate about this cause?
Yeah. Leaders bring to the table their own experiences, right? They bring their expertise, of course, but they bring their own experiences. And when you have a decision-making table on some critical health issue that affects the entire world, and you only have half the population present, you only have men there bringing their perspectives, you're missing out. We, the world, are missing out on what actually may be happening, what may be some of the different issues going on. And we saw this during COVID. We saw the sort of decisions that were being taken during COVID often that didn't have a lens, a gender lens, and as a result, they missed really important implications. So when there was, for example, curfews set, and yet women had to deliver babies. And nobody had thought about what are we going to do with women who have to get to the hospital in the middle of the night to deliver a baby when there's been a curfew. And we had reports, for example, of the police beating these women who are trying to get to the hospital in order to deliver their baby. And it's an example. This is what happens. You have a group of men who are making the best decision, but they're missing half of the perspective of the world. They're missing the women. And so we see example after example of this, that you're not getting as rich a discussion. You're not having as deep an understanding of the different elements of the challenges and the different components of the solution. So having women and men at the table yields much stronger, much better decisions, innovations, and outcomes.
Wonderful. Nobody can deny that this half lens, as much as it exists in the health sector, it is also in our political spheres, and we see that trickle down to public life all the time. What is the broader objective of your organization, and how does it align with this conference that is happening this weekend?
Yeah, well, our objective is to be advancing talented women leaders to have more influence, more power, to be using their leadership expertise, experience, perspectives in order to be improving, and for them to be doing that and lifting up others as they go. So we're particularly focused on what we call the mid-career women. So these are women who have often their PhD, they have their doctor degree, they have, as an MD, they've been working for 10 to 20 years. These women know what's needed. And yet they've been receiving messages throughout their entire lives that basically, as Chimamanda would say, they shouldn't shine too brightly. Right? They shouldn't be going for this higher level doctor position. They should stay as a nurse, for example. They shouldn't be at the decision-making tables. They should let a man do that. They shouldn't be putting their thoughts, their policy ideas, the innovation ideas that they have too strongly up front. And so these women have been told for their entire lives to kind of hide the light. And what we're finding is we need these women and we need their expertise and their experience to be able to address the health challenges. What happens far too often is women, especially at this mid-career point, where now the number of jobs are also narrowing, the elbows and the politics associated with the jobs are getting more and more subjectively driven about who knows who.
Right.
And of course, for many of these women, the demands of what it means to be a mother, a wife, a daughter, a community member are also increasing. And so too many of the women are either being pushed aside or they're opting out, and we're losing this extraordinary talent.
Right.
So for us at WomenLift Health, it's about, let's be investing in these women. Let's be giving them a safe space, sharing with them the sort of tools, giving them access to coaches and mentors and peer groups so that they can reconnect with their own purpose. They can be learning some of the tools to navigate their pathway to leadership, and that they can be leaving this program with greater intentionality about how they want to use their power as a leader to have impact.
So that would tell us about the organization, its overarching goals, and also this conference. Now, we want women to shine bright. How, going back to innovation and equity and sustainability, could you exemplify briefly for us how women leadership leads to that, and how this platform of WomenLift Health Global Conference also catalyzes that meaningful change on the ground?
Well, when you look at sort of inclusion and equity, it means having representation, right, of the people that are being served. And so in the health sector, 50% of the population is women. And yet that's the group that's not at the decision-making tables. And so for our work, which is all about that equity and inclusion, it is around investing in these women leaders in their own countries, in the different institutions in the countries, so that they are in a best position to navigate their own pathway to leadership, that they're able to bring their deep knowledge, their networks, their expertise to be supporting the health and addressing the health challenges that are around them in their community, in their state, in their country, in their region, and globally. We find many of what we're working on is universal leadership skills, human leadership skills. However, what we found is extremely important is that that's contextualized for different women around the world. So for example, WomenLift Health, we are working in India, we're working in 5 countries in East Africa, we're working in North America, and now Southern Africa. And while we have the same curricula, we have the language that's used, the stories that are used, the mentors, the coaches, the facilitators. Those are all from the country, the given country, so that we can be ensured that the relevance, the resonance of what this leadership work is, it sits very strongly with these women and speaks to them and speaks to the situation that they're operating in.
Wonderful, Amie. It seems like the organization is working within the context of all the people, the stakeholders that are coming from different parts of the world. Now, speaking to those people who are coming from different parts of the world, the stakeholders of the healthcare systems globally, how do you envision that they are going to use this platform to create new partnerships and collaborations, and to what end? What would be, would you say, a quantifiable or qualitative impact of that?
So for example, we offer a 1-year working women's leadership journey. So this is for a woman who's, embedded in her organization, doing her work, and then we are working with her virtually and through in person to take her through this year-long leadership journey. At the end of the journey, she then joins the alumni community. So she joins a larger group. She continues to play a role. She continues to have a network and have investment in her, and also invest in others. And it's that connection, it's that network of these extraordinary women, both within the country and across countries, that leads to just so much power for learning, for collaboration, and for change to have impact. So our work is, our goal is by the end of this decade, we'll have taken over 2,500 women through the leadership journey, and thousands and thousands of others through some of our other programs. We will be ensuring these women are continuing to connect. And what we're already seeing is these women walk away from the program, walk away with this leadership journey, and join the alumni with a much greater sense of confidence, with changes in their leadership competencies on the 8 competency factors that we focus on. And that's leading to an intentionality. It's an ownership and an intention around how each of these women choose to use their leadership power to have impact. And we see these women taking action. They're taking action inside their institutions. They're taking actions through their health work, in their communities, how they're engaging in with others, other health workers, or even younger women who are thinking about STEM or thinking about going into the healthcare industry. They're there as action-oriented change agents. Sure. And it's that kind of change that is what this is all about. It's these women know what to do and they're doing it. And the impact of their taking these kind of actions, using their leadership power, being willing to shine more brightly, is inspiring. It's extraordinary.
Absolutely. It sounds very inspiring to me, and I look forward to meeting hopefully some of these women at the conference during the weekend. Going back to the conversation of WomenLift Health, the organization. How does the organization itself practice inclusivity, diversity, and how do you see that impacting the healthcare sphere?
So with WomenLift Health, we believe very strongly it's not just what we do, it's how we do it. And so we have a very decentralized team. All of our work in countries is led by teams from the country, so that these are extraordinary leaders who understand the health system in the country, have the networks, have the credibility, understand the context within which women and male allies are working. And so each of these leaders with their teams are defining the strategy and then responsible for executing on it. So we have a very, very distributed power structure. Yeah. We also invest heavily in creating a strong global or cross-regional team. And the team, we work to build up what is our team agreement that everybody, whether you're based in India or in Kenya or in Canada or in Cape Town, we all have the same team agreements that we've written ourselves and that we abide by. We're all showing up with valuing each other, recognizing what we each bring to the table, the differences and the inherent value of those differences. And so, we spend a lot of investment with every single member of the team holding themselves accountable for a culture that values inclusion, that values diversity, that respects each other. And it makes for a fantastic work environment.
Absolutely. As they say, Amie Batson, the president of WomenLift Health, lead by example. Thank you for sharing your insights with us. Would you kindly give us a closing comment to the audience that is watching this show and will be attending the conference this weekend in Dar es Salaam?
I would just say we're very excited to be here in the United Republic of Tanzania, and seeing this opportunity to be talking about women's leadership, the power of women's leadership, and the role of male allies. Together we can change the world. We need men and women at the leadership tables making this happen.
Right. Now, this conference, WomenLift Health Global Conference, is only a day away from bringing together hundreds of healthcare stakeholders from around the world with one focus: to drive inclusivity and empower those who have made great contributions, namely women, and hold the spine to lead the charge. I wish you all the best, Amie, and hope to interact with you at the conference to learn more. But for now, this is the end of Focus on WomenLift Health Global Conference. Thank you for watching CNBC Africa.